One of the key things we need to think about with the Internet of Things is the proliferation or the volumes of data that we're going to be experiencing. One of the things we learned in developing National Electronic Health Records and thinking about interoperability between clinical systems was if we start with this concept that we can provide more information, better information to a clinician to help them do their job and hopefully a set of that information relevant to a consumer as well, for them to be more engaged in their healthcare, that we were concerned about a proliferation of that data. And this was still very small sets of information about discharge summaries and referrals and the like. So when we look at Internet of Things, what we're talking about is devices, small objects that have a very specific purpose. And those small objects are literally going to generate huge amounts of very simple data that needs to be processed. So one of the concerns that I guess I have is how are we going to deal with that volume of information? And the answer to that is the concept of analytics and I guess the ideas, some of the ideas from big data and visualization of data as well. So we've got to have that analytics idea in there, but then the ultimate problem I think we need to look at is this idea of how do we hand power, if you like, to those devices? Because the end game for us with these devices is for the devices to start making decisions on our behalf. So where you apply an algorithm that says based on input do something, these devices are supposed to get to a point where they are autonomous and effectively working together. And this is where I come back to that idea of we're giving over power, if you like, to these devices. So how do we make sure that more human-centred outcomes and human-centred design still remains at the core of what these devices will do for us? We talk about algorithms that are going to process that information, and we write algorithms today in software, like I said, simple input, simple output. This idea of artificial intelligence or deep learning algorithms, if you like, is where we are allowing the system to learn how to learn and to learn how to respond. And once again, this is the very important part, but because we've got so much information and the sort of connections that we can make between that data that make it useful is by and large going to be discovered by the system itself. In some respects it sort of goes beyond the realm of the human mind to imagine, and I think there are some very deep ethical questions that need to be asked. We get very interested in the what of genomics, the what of Internet of Things, the what of innovation, but it's important that in business we continue to take a systems-based view, and a systems-based view makes us look at things like why we're doing it and are we getting what we thought we were going to get out of it, and what are the sets of questions we need to be asking today when we imagine that future, and then how do we go about doing that. It's important that we are understanding the learnings that we get as we go along so that we can reapply them. And so not just the what, but why did we do it, where are we going, and how did we get there, and what do we need to keep doing. It's absolutely imperative that the CIOs, but as part of the whole business, are considering these sorts of waves of technology as they impact society. In many respects, sometimes it's hard to imagine in healthcare an Internet of Things, if you like, but when you think about it, there are lots and lots of devices that have a very specific purpose. So rather than saying, well, healthcare is late to this market, I actually think healthcare is ahead of the curve, we just haven't realised it. And so in this instance, you've got devices that have a very specific purpose to do an MRI or an image, or to analyse blood or whatever it might be. And it's that theory of how that device does its role within the clinical practice, and then how the data that's generated from that device makes its way into clinical systems that show up in front of human beings, doctors, when they're interacting with systems. So a lab information system that puts lab results into a clinical information system that holds patient data, and it's that overlap of data. So I actually think there's a lot of lessons from healthcare about how devices that have specific purposes generate information can actually have that information overlapped with other data sets, and then decision support and those sorts of ideas applied to it, such that we get value out of all that data and actually do something meaningful with it. When I say that, I think in many respects healthcare is ahead because we have the idea of devices that have very specific purposes, and that's one of the concepts of an Internet of Things, is that a light bulb has a very limited set of things that it can do. But it has a set of data that's relevant when you can overlap it with, say, sunset and sunrise times and have the light come automatically on. The trick here in most of these things, especially in the consumer world, is that you're not really selling the idea of an Internet of Things. You're selling a service, or you're making a service available. And I think a lot of the lessons from how markets are approaching consumers, that is actually relevant to the way government and business can look at its internal customers, the clinicians in this case, and healthcare workers. So I don't think it's a matter of marketing concepts like an Internet of Things. I think it's about providing really good solutions. As I said, the idea that there are lessons from health, I think, is relevant, because it's not an Internet of Things, if you like, in hospitals, but it's certainly a network of specifically connected devices, and a lot of informatics and effort gone to say, well, how does those sets of information overlap and actually give me something meaningful that a clinician or a user can work with? So in terms of timeframes, it's really a mindset shift, and this is, I think, the important role you mentioned before about where does a CIO sit in this. It's an important role in IT, but in business, to not get caught up in the hype, and when new buzzwords come along, whether it's a big data or these sorts of concepts come along, it's really important to understand what they're about and then reflect on what your own business does today and look at the success that you're having in your organisation in doing that. Disruptive innovation has its place in the world, but the concept of incremental innovation is important as well, because they're the stepping stones that businesses are able to make very easily without really upsetting all of the stakeholders. So I think that journey is probably shorter than we imagine, but if we create a large barrier around hype and a whole set of issues, rather than focusing on what we practically know works today and how to build on that, then I think we can make that cycle come in a lot sooner.